Tonight, before you close your eyes, your body will give you 7 silent warnings that your heart is struggling. Medical data shows your highest risk of a heart event happens while you sleep, but your heart does not fail silently. It whispers warnings exactly 15 minutes before you fall asleep. Stop guessing and start acting. Most people think a failing heart announces itself with dramatic chest pain, just like in the movies. But if you are over 50 years old, the reality is completely different. The warning signs are microscopic. They happen in the quiet moments right before bed, when you are simply reading a book or turning off the lamp. During this specific 15-minute window, your cardiovascular system attempts to shift gears from daytime stress to nighttime recovery. If your heart muscle is weak, stiff, or lacking oxygen, it cannot make that transition smoothly. Instead of resting, your heart starts a silent panic. It pulls blood away from your skin. It lets fluid pool in your lower legs. It sends distress signals to your nervous system that you mistake for simple insomnia or room temperature changes. Ignoring these signals is like ignoring a fire alarm because you think it is just the wind. Tonight, that changes. I am going to walk you through 7 specific physical signs you need to check the moment you lie down on your mattress. You will not need any medical equipment, just your own eyes and hands. Count how many of these 7 signs you experience tonight. Let us start immediately with sign number 1, the sock mark test. Let us start with something you probably brush off every single day, the sock mark. Tonight, when you sit on the edge of your bed and pull off your socks, look down at your ankles. Do you see a deep red or white indentation ringing your lower leg? If you press your thumb firmly into that line for 3 seconds and pull it away, does the dent stay there, staring back at you like a footprint in the mud? You probably blame tight elastic. You tell yourself that you just bought the wrong brand of socks, or that you have been standing for too long today. But I need you to listen very carefully. That is not a clothing problem. That is a cardiovascular warning. In the medical field, we call this pitting peripheral edema. Here is exactly what is happening inside your body. Your heart is a powerful mechanical pump. When that pump becomes stiff from age or weak from years of untreated high blood pressure, it loses the sheer force required to pull blood all the way back up from your feet against the pull of gravity. So, what happens next? The excess fluid literally leaks out of your blood vessels and pools into surrounding tissues of your lower legs, your ankles, and your feet. This is your cardiovascular system waving a massive red flag before you even lie down to sleep. If that indentation takes more than 10 or 15 seconds to bounce back and disappear, your heart is working overtime just to handle basic daily circulation. Do not ignore this and go to sleep thinking everything is perfectly fine. A healthy heart clears that fluid effortlessly. A struggling heart leaves a deep dent at the end of the day. Check your ankles tonight. Do this simple test. If the mark is deep and lasting, you have just found your first silent warning sign. But the danger does not stop there. Because the moment your head hits the pillow and your body goes flat, sign number 2 takes over. Now, let us move to sign number 2. You pass the ankle test, you turn off the light, and you lie flat on your back. Within exactly 10 minutes, you feel a strange tickle in the back of your throat. You start to cough. It is a dry, hacking cough that just will not stop. What do? You probably blame the dust in your bedroom. You think your throat is dry or you have seasonal allergies. Stop guessing. That is not dust. That is fluid backing up into your lungs, and it is a massive warning sign of a struggling heart. Medical professionals call this orthopnea. Listen closely to the mechanics of what is happening inside you right now. When you stand or sit during the day, gravity pulls your blood downward. But the second you lie flat on your mattress, all that blood volume from your legs rushes back up into your chest. Your heart suddenly has to pump a much larger amount of blood. If your heart muscle is weak, it cannot handle this sudden traffic jam. The blood backs up into the pulmonary veins, pushing fluid directly into the air sacs of your lungs. Your body forces you to cough because it is literally trying to clear liquid out of your breathing pathways. Here is the ultimate test you can do tonight. When that cough starts, Grab 2 thick pillows and prop your head and chest up. Wait 5 minutes. If the cough magically disappears, you do not have a dust allergy. You have a heart that is begging for help. Elevating your chest uses gravity to pull the fluid out of your lungs, relieving the pressure on your heart. Do not ignore this. A 10-minute pillow cough is a red alert. Now, let us talk about your feet, because sign number 3 is going to shock you. Let us move directly to sign number 3, the cold foot paradox. Imagine this. You are in a warm bedroom. The thermostat is set perfectly to 70 degrees. You are under a thick, heavy blanket, but your feet feel like 2 blocks of solid ice. You rub them together, you put on an extra pair of thick wool socks, but that deep, bone-chilling cold simply refuses to go away. Most people assume this is just a normal part of getting older or a sign of an innocent circulation issue. Stop believing that dangerous myth right now. This is not about your blanket, and it is not about the temperature of your room. This is your body entering a silent survival mode. Let me explain the exact mechanics of what is happening inside you. Your body is a ruthless survival machine. When your heart muscle is weak and cannot pump enough oxygen-rich blood to supply your entire system, your nervous system makes a split-second calculation. It decides that your toes and feet are simply not essential for keeping you alive tonight. Your brain is essential. Your lungs are essential. Your liver is essential. So, what does your struggling heart do? It aggressively tightens and constricts the blood vessels in your farthest extremities. It literally steals the warm blood away from your feet and hoards it in your core chest area to protect your vital internal organs. That freezing sensation right before you fall asleep is the physical feeling of your heart rationing blood because it lacks the mechanical power to circulate it fully. If your feet are chronically freezing every single night despite being in a warm bed, you are not just a cold sleeper. You are experiencing a localized cardiovascular drought. Do not put on another pair of socks and ignore it. Your heart is waving a red flag. And as shocking as this survival mechanism is, sign number 4 is even more alarming because you can literally feel the traffic jam happening right in your neck. We have reached the 4th sign. And this is where most people make a fatal miscalculation. I want you to pay close attention because this is our first major warning that you might be misunderstanding your own body. When you lie down on your side tonight, I want you to place your index and middle fingers gently on the side of your neck. Do you feel a massive, heavy throbbing sensation? If you happen to look in a mirror, can you actually see the vein bulging and pulsing with every single heartbeat? Most people smile when they feel this. They think to themselves, my pulse is so strong, my heart must be incredibly powerful. Stop right there. That is a dangerous medical myth. That heavy throbbing is not a sign of cardiovascular strength. It is the ultimate sign of a biological traffic jam. In cardiology, we call this jugular vein distension. Let me explain the exact science of what is happening while you lie in bed. Your jugular veins act like main highways carrying used blood from your head back down into the right side of your heart. But what happens if the right side of your heart is weak, stiff, or simply failing to pump efficiently? The blood cannot enter the heart fast enough, so it backs up. It reverses pressure directly into your neck. That bulging pulse you feel is not forward momentum, it is backward pressure. Your heart is literally rejecting the blood, trying to enter it because it is too exhausted to pump it forward into your lungs. If you feel this aggressive throbbing on the side of your neck while lying down, and it does not go away after a few minutes of resting, you cannot afford to ignore it. You are not feeling a healthy pulse. You are feeling the exact moment your heart is failing to keep up with the basic demands of your circulation. Do this simple finger test tonight. Do not wait for a doctor to do it for you next month. You have the power to check this right now. Your body is giving you the data. You just need to know how to read it. And if you thought that was concerning, wait until you hear about what happens inside your mouth in the middle of the night. Sign number 5 is something almost everyone experiences, but nobody connects to their heart. Let us move to sign number 5. This is a symptom almost everyone experiences, but 99% of people completely misdiagnose. You wake up at 2 in the morning and your mouth feels like an absolute desert. Your tongue is stuck to the roof of your mouth. So you reach for a glass of water, take a big gulp, and go back to sleep. You tell yourself you were just dehydrated. Stop believing that. If you went to bed properly hydrated and still wake up with a bone-dry mouth, your heart is sounding a critical alarm. Here is the biological data you must understand. When your heart struggles to deliver enough oxygenated blood while you sleep, your body panics. To force more oxygen into your lungs, you subconsciously open your mouth and start breathing heavily. You are gasping for air without even waking up. This is a massive red flag for sleep apnea, a condition that places lethal stress on your cardiovascular system. But the medical danger goes much deeper. When your blood oxygen drops, your brain triggers an aggressive sympathetic nervous system response. It dumps adrenaline straight into your bloodstream. Your heart rate violently spikes. This internal fight-or-flight emergency instantly shuts down your salivary glands. Your mouth goes dry because your body thinks it is fighting for survival in the dark. Drinking an 8-ounce glass of water will wet your throat, but it does absolutely nothing to fix the severe oxygen crisis inside your chest. If you experience this dry mouth more than 3 times a week, do not just refill your water glass. Recognize the biological warning. Your heart is suffocating. You need to take action. And that leads us directly into sign number 6, which is by far the most terrifying sensation on this entire list. We have reached sign number 6, and this is our second major twist of the night. This symptom is not physical at first. It is entirely psychological, and it is destroying your sleep. You lie down in bed, completely exhausted. Your body is ready to sleep. But right as you start to drift off, a sudden wave of intense anxiety washes over you. Your chest feels tight. Your heart skips a beat. You feel a strange sense of impending doom, like something terrible is about to happen, but you have no idea why. What do you normally do? You probably get out of bed, walk around the room, and blame yourself for being too stressed. You think you are developing an anxiety disorder. Stop blaming your mind. This is not a mental health crisis. This is a mechanical cardiovascular crisis. Let us look at the exact biological data. When you begin to fall asleep, your breathing naturally slows down. But if your heart is struggling, that slower breathing causes your blood oxygen levels to drop to a dangerously low point. Your brain monitors this oxygen level constantly. When it detects the sudden drop, it thinks you are suffocating. To save your life, your brain dumps a massive surge of adrenaline directly into your bloodstream to force you to wake up and breathe faster. That sudden anxiety, that impending doom, that racing heart, that is the adrenaline hitting your system. You are not going crazy. Your heart is literally sending an emergency distress signal to your brain because it is starving for oxygen. If you feel this unexplainable panic right before sleep, do not just take a sleeping pill to force your brain to shut down. You are silencing the fire alarm while the house is burning. You must address your cardiovascular health immediately. And believe it or not, the final warning sign is something you can actually see on your face right now. Let us move to sign number 7. We have reached the 7th and final sign, and this is without a doubt the most bizarre, yet scientifically documented warning on our entire list. I want you to get out of bed right now, walk into your bathroom, and look closely at your earlobes in the mirror. Specifically, look for a deep diagonal crease slicing right through the middle of the lower fleshy part of your ear. In the medical community, we call this Frank's sign. It sounds like a strange internet myth, but I assure you, this is hard cardiovascular data. Multiple peer-reviewed medical studies have confirmed a direct link between this specific diagonal earlobe crease and severe coronary artery disease. Why does this happen? Let me break down the biology. The blood vessels in your earlobes are incredibly tiny and fragile. When you develop atherosclerosis, which is the dangerous hardening and narrowing of your arteries, these microscopic vessels in your ears are often the very first to lose their vital blood supply. Without proper blood flow and oxygen, the underlying tissue literally collapses and degenerates, creating a permanent, visible crease that looks like a deep scar. If you look in the mirror tonight and see a deep diagonal line across your earlobe, You cannot simply brush it off as a normal wrinkle of aging. Your cardiovascular system is showing you physical, external evidence of internal arterial decay. This is a biological cheat code. It is a visible red flag that your heart is severely struggling to pump oxygen-rich blood to the extreme edges of your body. Check your own ears tonight. Check your spouse's ears. Check your parents' ears. If you see Frank's sign, especially if it is on both ears, and combined with any of the other nighttime symptoms we just discussed, you must stop waiting. You need to schedule a cardiology appointment immediately. Your body is literally giving you the answers on your own face. Now, it is time for the most important part of this entire video. What do you actually do tonight to protect yourself? You just checked your body. Maybe you found the ankle mark, or maybe you felt the heavy pulse in your neck. Do not panic. Panic spikes your blood pressure and makes everything worse. Your body gave you these warning signs so you could take action, and you are going to act right now. Here is your 3-step bedtime reset protocol to protect your heart tonight. Step 1. Elevate. If you experience that dry cough, do not lie completely flat. Grab one extra pillow and elevate your upper body. This mechanical shift uses gravity to pull fluid away from your lungs, instantly reducing the workload on your heart. Step 2. The nitric oxide sip. Do not chug a massive glass of water before bed. Instead, drink exactly 4 ounces of water with a fresh squeeze of lemon juice. This helps your blood vessels produce nitric oxide, naturally dilating your stiff arteries and making it easier for your heart to push blood to your cold feet. Step 3. The vagus nerve reset. Close your eyes and breathe in through your nose for 4 seconds. Hold that breath for 7 seconds. Exhale slowly through your mouth for 8 seconds. This specific sequence stimulates your vagus nerve, shutting off the adrenaline and forcing your heart rate to safely drop. Do not keep this a secret. There is someone in your life, a spouse or a friend over 50 years old, who is going to bed tonight unaware that their heart is struggling. Share this video with them right now. It takes 5 seconds and it could save a life. Take control of your health, follow the protocol, and sleep safely tonight.